So we're going to do a full body skin exam, and I want to start with your feet. So surprisingly, the feet are really important because if you get a pigmented lesion down there that looks abnormal, the incidence of it turning into melanoma for some reason on the feet is much higher. So a lot of people, neglect that, but it's important to check that area. So you have these pigmented lesions, but they're all fine so far. These are nice and tan. They're not real dark, and they're not the size of an eraser on a pencil, which is typically what we look for, or maybe like a real jagged border to it, or something that's just not healing up, a sore that doesn't heal. Those are the kinds of things that we look for. So even though you've got a lot of these moles, so far they look pretty good. Let's look at your hands. Okay. So you've got something here, it's called a keratosis, which we can freeze off later, but it's not a skin cancer. But we like to get rid of those because it can turn into skin cancer at some point. And here, it looks like you just scratched yourself. Your dog or something.
Yeah.
Okay. Okay. So you got a dark one here that we should check. So when we're done, we're going to use the AI DermaSensor on that. Okay, I'm going to have you, well, let me a sec. I'm going to hit your chest. And typically, I tell people come in once a year, because that way, if something develops within a year's time, we're going to catch it early enough before it spreads or metastasizes. Do you use much sunscreen?
No, not as much as I should.
Yeah. And you got a little bit of thing here we can freeze. Any bumps or lumps in the scalp that persist?
No.
Okay, I'm gonna have you stand up for a second. Let me look at your back. Okay. So those look good. You got one back here we got to do the DermaSensor on. And I'm gonna have you move over here for a second. Can you move your legs apart? Okay. All right, so that all looks good. All right, so now we got to do the DermaSensor on a couple things. All right, you want to have a seat there?
Sure.
All right, so we're going to start with your face. And this is an AI-assisted device that tells us if any of these pigmented lesions are of concern without even doing a biopsy on it. So that's the beauty of the DermaSensor. Before this time, we would end up doing a biopsy, and sometimes, you don't necessarily need to do that. So this is a nice screening method. It's just 5 little zaps, and then we just wait for the results to load. And that showed an 8. So 7, 8, and 9 indicates that there's some abnormalities there that warrants a biopsy. So the next step would be to get you set up for a biopsy on that. But you've got a couple others that we should check too.
Maybe the next one show this.
Yeah. All right, so. All right, we're gonna do this one as well. Okay, and then what we do is we just look at screen if you want to get, and we're good with that one. All right, we're gonna do one more. That's a keratosis, we can freeze that.
Okay.
But you had a dark one right here I wanted to get. Okay, here we go. Last one. Okay. Okay. And we're good there too. So we're all set. So you have one that's abnormal that we need to get rid of. So on Kirk, what we did was we ended up doing the DermaSensor on this lesion here during his full body exam. And it came back an 8 or a 9, which indicates that there's probably some malignancy there. So at that point, then it warrants a biopsy. So I'm just gonna clean the skin, give him a little pinch of lidocaine to numb it up. You're gonna feel a little pinch now. You ready? Just a little bit of pinch. Sorry. Should be getting numb now. Okay. Now, do you feel that at all?
No.
Okay, good. All right, so we're gonna let that sit. While we do that, he had a lesion here that is called an actinic keratosis, which is a precancerous lesion. And that we can just freeze with this liquid nitrogen, so we don't have to do any lidocaine or cutting or anything. So this, I'm gonna have you keep your eyes closed. This is a real cold spray, and I'm gonna zap it 3 times. Here we go. It's gonna kind of make you, it's a little bit of a bite. And one more time. Okay, and then I'm gonna just turn you so they get it on the camera. Okay, so one more. That's it. And what'll happen is this will just scab up and peel off over the next week or so, and you can get it wet, shower, you don't have to do anything special. Oh yeah, then we can get this one too. Yep. Okay, so that's all good. All right. So we're going to just wait for this lidocaine to kick in for a minute, and then we'll do the biopsy. So now we're going to do a little biopsy on this lesion that the DermaSensor told us was high suspicion for skin cancer. Does that hurt at all? You good?
I'm good.
Okay. So that's all there is to the biopsy. Now, living in Cabo or places like Arizona or Southern California, the incidence of skin cancer is much higher because it's related to sun exposure. And it increases with each decade. So oftentimes people in their 50s, 60s, 70s, and 80s have a real high incidence of this. People that are a little bit younger, it doesn't show up quite as early because it's really a cumulative factor with sun exposure. So it's really important, especially between the hours of like 10 and 2, to wear sunscreen in sunny areas. Wear a hat, that's important. And then I just recommend that people come in once a year and have their full body skin exam done. That way, if something develops within a year's time, we're gonna catch it early enough so that it's not gonna spread or metastasize. Because if a melanoma metastasizes or spreads, it can be deadly. It kills about 1 out of 70 people. So, and that incidence is increasing. So it's really important that people come in for their yearly skin exams. That's it. Give you a little Band-Aid on there and you'll be good.